everyone. Most of you asked me to say something on coronavirus, aka COVID-19. The reason I haven't done that so far is because it's so new to the medical fraternity as well, and especially me being a junior doctor, that I really had to read up on it and make sure that I wasn't saying something that hasn't been proven, researched, and is absolutely accurate. So I've made a video. It's slightly longer than I wanted it to be, so you might have to bear with me, but it does incorporate everything that you need to know about coronavirus. Number one, don't panic. Rather, educate yourself. With the constant stream of information that's coming in through social media, media in general, it's only natural to feel fearful and anxious and uncertain. And the best thing you can do at that time is to educate yourself about what we're really dealing with. And you could also have a chat with your doctor. It would clear up a lot of doubts and relieve a lot of stress. Number two, don't treat other people like your competition, because they're really not. We are all in this together, and it's important at this time that we share our resources. So when you go to the grocery store, take what you need, but be mindful of others. Chances are that if you get your hand on a sanitizer and somebody else doesn't, and that person unfortunately happens to get infected, they're going to spread that infection around. So the most effective way really is to share. Number three, don't use masks unless you know how to or absolutely need to. Now, what does that mean? So surgical masks, N95 masks, and masks in general are designed to avoid from your own cough droplets going outside and infecting others, which basically means that they trap germs, and they're probably going to trap the virus and result in infection to yourself if you're not able to use it correctly. When is it recommended that you use a mask? Some of the valid reasons to use a mask are if you are a health professional. If you are caring for somebody that is actively infected with the virus, if you are somebody that is at high risk, so if you are over 60 years of age, or if you for some reason have a suppressed immune system, or you're living with a chronic disease. In these cases, you may want to use a mask, and if you do that, make sure that you know how to use it correctly. This is what you should be doing. So your do's are: number one, hand washing and hand sanitizing. This is probably one of the most effective things that you can do on a daily basis to keep yourself as far away from getting infected as possible. There is a correct way of doing this. So hand washing, hand sanitizing is a big. Number two, do maintain a respectful and healthy social distance. What does that mean? It means that COVID-19 depends primarily on droplet spread for the infection to go around. However, COVID-19 droplets aren't able to travel long distances in air, so as long as you maintain a healthy, respectable social distance, it will really help contain the infection. Number three, do self-quarantine and self-isolate if you feel that's what you need to do. So if you have been traveling a lot recently, if you seem to be coughing, sneezing, especially dry cough, if you come down with a fever along with a cough, and there are a ton of other symptoms, but these are the ones that are likely to come before all of the other symptoms, make sure that you are responsible enough to self-isolate. And when you do that, you're probably going to self-isolate in your house. So make sure that you keep your bed linen, towel, other toiletries, and even your dishes separate to others, because the best way to make sure that the disease is contained is to aggressively, actively, responsibly self-isolate and self-quarantine. Just keep in mind that coronavirus has already established a foothold in numerous countries, and it is absolutely important that we together control this infection by self-isolating and doing all the other things that I mentioned in my video. So I think we can get through this together, and let's not panic.